Okay, so welcome back to Everyday Academia. I'm Tim French, here with Dr. K as always. Today we're diving into what's honestly become this tidal wave, or tsunami, I guess, of mental health issues on college campuses. That metaphor gets tossed around a lot, but it feels kind of right, given just how quickly things have gotten overwhelming, right?
Absolutely, Tim. Tsunami really captures both the scale and, the suddenness of it all. Research and, what we've seen in practice show it really amped up after COVID, but it's not only the pandemic, it's all this compounded social unrest, disruptions to what campus life was supposed to be, routines, social supports, all kind of crumbling away for students and staff alike. The World Health Organization tracked about a 25% global increase in anxiety and depression after COVID on campuses. It translates to more students saying they need help, often for the first time in their lives.
I keep coming back to something I read. Before the pandemic, about 11% of people in the US reported a mental health concern, but that shot up to around 20% after COVID. That's basically 1 in 5 folks, and honestly, our counseling centers are stretched way beyond capacity. I was talking with the folks on our campus, and wait, let me get this right. 1 in 4 psychologists in a national survey said they literally couldn't keep up with the demand. And 70% had growing or new waitlists. Students are asking for help, but there just aren't enough seats.
It's the same story everywhere, Tim. And what gets missed is how many don't even get as far as making it onto those wait lists. Less than half of people with mental health concerns actually receive services. There are barriers, stigma, limited services, or just a lack of knowledge about where to go. The system itself, as the American Journal of Occupational Therapy described it, is kind of fractured. Many students just fall through.
Yeah, and the other day, I was thinking about the stuff we all went through during those early lockdowns. Even just from my end, trying to support my students from a distance, but feeling pretty helpless a lot of the time. Dr. K, I know you actually had to walk through that early on with students. Want to share?
Sure, early in the pandemic, I remember working with a student. Let's call them Sam. Sam had done okay in school, but suddenly courses went remote, clubs stopped meeting, and all their structures just disappeared. I was chatting with him one day and said, I don't know how to do school anymore. And that was the moment it hit me. There's this whole layer of students quietly struggling. It's not just the ones who reach out directly. There's an epidemic of hidden isolation and loss of routine. OT folks saw this gap because our lens is all about the daily, meaningful stuff that holds mental health together, which just fell apart for so many.
Yeah, I feel like that's the story for a lot of folks. The visible numbers are bad, but the hidden stuff, the disconnect, students fading from classes or campus life, that might be worse, and we're still honestly figuring out how wide that gap really is.
So building on that, Tim, occupational therapy actually has a kind of deep history with mental health right from the beginning. In 1917, OT was, created to help people find health through meaningful activity in hospital settings for mental illness. And we grew rapidly in the following years supporting veterans returning from war. But fast forward to now, and honestly, the field's often overlooked as a mental health solution on campuses. Outside OT circles, even big national groups don't list OT among core mental health professions. There's just a disconnect between what OTs actually offer and what's recognized. And that's something we've touched on in past episodes.
Yeah, even as a dean, I gotta say, I mostly heard about OT after my mom had a stroke, not as something that, helped mental health. But you keep breaking this down for me. OT isn't just about exercises or motor stuff. It's about routines and occupational balance, right? I always mess that up. Anyway, I think this is where OT's unique. You look at what people do across their days, their habits, their sense of purpose, right?
Exactly. We're trained to see how disruptions in daily activities, getting up for class, eating, connecting with people, impact emotional well-being and participation. Something as simple as losing a morning routine can cascade into, a crisis. We use tools like the AOTA occupational profile. It's basically this deep dive into daily life patterns, which lets us identify risk points for mental health and suggest interventions. Things like reimagining what a successful day looks like, building new habits, or finding creative outlets.
And it doesn't have to be complicated, right? I remember a student from our business program who was super anxious and struggling with the grind. They started spending time in the campus makerspace, working with their hands, and suddenly their energy shifted, grades got better. That whole stereotype, business students don't do art, just didn't hold up. Turns out getting hands on something, even building little robots or crafts with others, was exactly what they needed to reset. I guess you'd call that meaningful occupation?
That's a perfect example. Research in the AJOT review shows creative occupation-based activities, think ballroom dance, gardening, even group projects, can be powerful for restoring occupational balance and mental health, especially in higher ed settings. And as we've talked about before, these can be individualized instead of one size fits all, which makes them accessible to a wider variety of students, international, neurodivergent, you name it. OT can spot the fit between what's meaningful for that person and what the environment offers.
So, bottom line, the OT perspective is all about seeing campus as this whole ecosystem, where if you adjust the daily experience, you actually support mental health at the roots, not just patch things when they break down.
Exactly, Tim. And honestly, the more campuses that can embrace this occupation focused lens, the better chance we all have to surf the tsunami instead of getting caught in the undertow. I didn't mean to use that analogy, but it does fit.
All right, so let's talk solutions. Dr. K, what should campuses and honestly folks like me in administration be doing to respond to this mental health tsunami with an OT lens?
Great question. Part of it is about early detection and culture shift. Campuses need to weave OT-informed mental health supports into their normal operations. That starts with regular mental health screenings. OTs can use the occupational profile or other tools as part of their daily work. Second is advocacy. OTs, students, even faculty can step up to educate decision makers, show outcomes, and challenge outdated ideas about who belongs on a mental health care team.
Yeah, and I'll admit, sometimes I think that's not my role, but in reality, deans and staff can drive change if we actually see the gaps. In my college, we noticed lots of students falling through the cracks on mental health. So we're piloting safe space training alongside student orgs, trying to create a culture where it's okay to say, hey, I need help. But I feel like we've barely scratched the surface.
That's a really positive step. Safe space trainings, mental health first aid, or even peer support models are all in the OT playbook. What makes them effective is alliances. Change happens when we rally student leaders, residents' life teams, faculty, and groups like NAMI together. And as highlighted in recent occupational therapy literature, we do best when we bring in those with lived mental health experience as peer specialists or collaborators in programming, not just professionals talking to students.
You know, even things like joining local boards or partnering with campus organizations outside our own departments can move the needle. In a way, it's about pushing these ideas into every meeting, every student org event, every syllabus. It doesn't have to be perfect, just constant.
Exactly, Tim. And OT faculty can connect with community groups, model proactive advocacy, or help build practical skills into classroom projects. The AJOT article actually recommends that all stakeholders, students, practitioners, educators find ways to act, volunteer, publish outcomes, and mentor others. Sometimes the small collaborative steps end up being the most powerful over time.
Yeah, and for other deans, staff, students out there listening, don't be afraid to try something or to reach for partners outside your usual circles. We're all learning this as we go, but every bit of support matters.
Absolutely. It's about progress, not perfection. And remembering that even little things, adding a screening tool, building a campus network, speaking up at a meeting, collectively start to shift the system. We can help campus communities ride this wave, not just brace for the impact.
All right, Dr. K, I think that's a good place to pause for today. Lots to think about and honestly, plenty of action steps for folks to get started on. Thanks for walking us through all of this, as always.
Thanks, Tim. I always appreciate your perspective and, hey, the way you keep it grounded. We'll keep following up on how these ideas play out across campuses. So stick with us for more everyday academia. Goodbye, everyone.
Yep, thanks for listening and see you next time. Take care, Dr. K.